Hello there. Thank you for being here once again, connecting with Live Healthy Miami Gardens, a health initiative of the great city of Miami Gardens in Florida. Thank you so much for being a part of this experience. This is sponsored by the Live Healthy Miami Gardens initiative, whose mission is about community health care, that our people being equipped with the skills and the tools and the wisdom and the experience to live and play with healthy lifestyles. That is essentially our mission, that of the Live Healthy Miami Gardens. You see on the screen the website where you can get more information, and I hope you will check in, connect, that you can send your questions, your comments, your suggestions, that essentially we work together to live healthy and play healthy. Thank you so very, very much for being a part of this experience. Please use the chat box. As you see, Ann Bennett has jumped in saying hello, and I pass along the hello to all of us. So use the chat box as we go along with your comments, your questions, your pearls of wisdom. Really, let's make this our community initiative. Live Healthy Miami in the city of Miami Gardens, the great city of Miami Gardens. Today we have an exciting, and I do mean that as I have just said it. Our guest today is Moses Allen, Vice President, Pharmacy of Sunshine Health. And Moses is here today to share the conversation about the importance of COVID-19 vaccine. The question is, have you taken had your jab? Have you gotten your vaccination as yet? Or maybe if you are someone in your family, as it has been in my own family, there's the hesitancy, the just having heard or listening to this comment or this myth. But today we want to address and dispel the myths and sharing the facts instead about the COVID-19 vaccine. And that is where grateful to Mr. Moses. Thank you very much, Mr. Moses Allen, for being here with us today. Welcome, 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 sir.
Thank you. Can you hear me okay?
Absolutely, yes. Loud and clear, and wouldn't have it any other way on this wonderful day. So first, Moses, can you tell us a little bit more about Sunshine Health and what you do as the Vice President of Pharmacy there?
Yeah, absolutely. And thank you, Father Ward, for having me. Very excited to be here today. Sunshine Health is actually one of the largest health plans in the state of Florida. We serve approximately 1 million residents throughout the state. We offer healthcare plans for every stage of life that fits your budget. For example, Ambetter is a health insurance marketplace option available to individuals and families. So when you choose Ambetter from Sunshine Health, you're covered for benefits such as maternity and newborn care, mental health services, prescription drug coverage. And if you'd like to learn more about Ambetter, you can visit our website at ambetterfl.com. In addition, Sunshine also offers Medicaid, long-term care, Medicare plans, and much more.
Thank you so much. And that is certainly what you have shared, part of the mission of Live Healthy Miami Gardens initiative, to connect with our people, to deliver the health caring for our wonderful community. I'm sure many of our viewers will want to check out more from ambetterfl.com, ambetterfl.com, or to call on the number you see An 877 number is scrolling at the bottom of the screen. So let's look a little closer. Let's zoom in. Can you tell us what you do as Vice President of Pharmacy?
Yeah. As Vice President of Pharmacy, I lead the implementation of the health plan's policies and goals for our members' pharmacy services and benefits. It's a pretty exciting job.
And a very, very necessary, timely, relevant, very, very important. And again, the gratitude, and I'm truly excited here to be able, in having you, sir, that our people who of Miami Gardens and others listening in can be able to see that they have access to resources for the kind of services that you mentioned earlier on. Today's topic is about the importance of COVID-19 vaccines. So let's jump right into that. Moses, kindly tell us what the COVID-19 vaccines are, please.
Yeah, absolutely. COVID-19 vaccines are developed to fight the COVID-19 virus. When you think about it, they work the same way as other routine vaccines that we get throughout our lifetime. But it's also important to understand how vaccines work, in the human body. Vaccines can stimulate your immune system to produce antibodies that actually fight against a disease, exactly like it would as if you were exposed to the actual disease itself. But after you get vaccinated, you develop an immunity to the disease without actually having to get the disease itself.
This has been COVID over this past year has really been wow. If you choose one word, it's difficult to find another word. Is how devastating it has been.
Great.
Part of my own life story is that I have lost friends. I've lost parishioners at Holy Family Church here in the city of Miami Gardens, where I serve as rector. And it is still ravaging in our community with the Delta variant. It has been a very, very painful, and so it's good here to be able to talk about the hope that there is as a way of encouraging more persons to better understand the facts, move away from the myths, the untruths or half truths about the COVID vaccines. I heard you mention immunity, but in the news we're hearing a lot about the Delta variant and those who have already been vaccinated getting sick with COVID-19. This is correct.
Yeah, you're correct. And certainly the Delta variant is certainly a game changer. There have been some breakthrough cases in individuals who have already been vaccinated. However, it's important to note that, those infections have only occurred in a small portion of the people that are fully vaccinated, certainly in comparison to those that aren't vaccinated. And when we're seeing that if a vaccinated person is infected with COVID-19, generally the adverse effects are much milder than, again, versus someone that is unvaccinated.
Is that why it is still important for everyone to get the vaccine, even if they have already had COVID-19?
Oh, absolutely. And there's a couple of reasons why. So number one, vaccines reduce the risk of spreading the virus to those around you. If you have kids under 12, like me, or other individuals in your family that can't get the vaccine for medical reasons, you definitely want to get the vaccine to, number one, protect them. Secondly, if you've already had the COVID-19, you actually can get it again. What the vaccine does is it helps reduces the risk of getting it or passing it on to others. And then lastly, we are, to your point earlier about the Delta variant, we are seeing breakthrough cases and people who got the vaccine and have tested positive despite being vaccinated. However, again, if you are vaccinated, those the symptoms that you're going to experience are going to be milder versus an unvaccinated patient. In fact, the CDC and a couple of other publications have actually stated that close to around 25 to 30% of patients who have had these breakthrough infections are actually asymptomatic. They don't even experience any symptoms at all. So when you think about that being vaccinated versus being unvaccinated, it really boils down to a situation where if you're vaccinated and you obtain the virus, your symptoms could range anywhere from maybe a common cold to a light flu, versus if you obtain the virus and you're unvaccinated, you could be in a situation where you're put in the hospital on a ventilator or even death. So it's a pretty wide range there.
Welcome again to those our guests who are online and watching this conversation about COVID-19 vaccines. And we cannot stress and encourage enough to get the facts. There's so many myths swirling around. I do Twitter and Instagram, and I see, again and again and again, comments that just blow my mind, which is, one reason, Moses, that as much as have tried growing my hair, when I read the kind of myths, I'm saying, no, 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 we need to be able to put forward the reality. We need to put forward the accuracy. We need to put forward the truth as we encourage our people to get vaccinated. Let me just trip out a little longer on some things you just said a while ago, and I'm so appreciative of in your response a while ago, encouraging people to get vaccinated. You made reference to children under 12, and for families to be very, very mindful, to seek out the facts. More research is being published. More work is being done on. It seems to me, as I understand it, eventually to make vaccines available to children under 12. But right now there are vaccines out there that are available for children, young people over the age of 12. But the important thing is for families to stay on top, follow the facts as we will continue hearing more as to how we can care for our children under 12. And the other piece of it is that, as you said, even if you have already COVID-19, you can get it again. There was a tendency, and I saw it at large. And in truth and in fact, I too, in my own self, felt, okay, so I got my vaccine, and more and more, people are getting vaccinated. I can breathe again. I can relax. I don't have to wear the mask, and I can do the closer than 6 feet social distancing. I had to stop. The thing is still here. And I need to contribute to our getting healthy together. So I needed to wear my mask. I needed to social distance. I needed to do the hand sanitizing, where to take responsibility. And thank you for emphasizing that. So, those are some very helpful, impactful reasons. But there is still a lot of vaccine hesitancy, sir, here in our country and in our communities, and yes, even in the city of Miami Gardens, and surely at Holy Family Church in that city, as well as in other places there in the city. Do tell us a little about the safety and testing of the vaccines, would you?
Yeah, absolutely. And again, just to go back to one of your prior comments, this definitely isn't the time to let your guard down. You certainly want to, stay on guard here. But as it relates to vaccination hesitancy, it's important to note that Pfizer, one of the manufacturers of the vaccine, actually received full FDA approval from the FDA for ages 16 and older. So we really hope that this helps to alleviate some of the fears or the concerns, about the vaccine. I know there's been a lot of talk about, hey, look, I don't want to take the vaccine. It seems like it was rushed to the market. I just don't feel comfortable. And what I'd like to just share is, even if you receive the Moderna or the Johnson and Johnson vaccines, you really still shouldn't be concerned. All three U.S. vaccines were originally approved for emergency use by our top medical experts and the FDA. So the fact that they were approved on an emergency basis really doesn't mean that there were any shortcuts taken or that they were any less safe, than a typical vaccine. In fact, there actually were some extra steps and guidelines that need to be taken for emergency approvals. So the safety and efficacy, it still has to be proven. They still have to pass clinical trials in which tens of thousands of people are actually tested. So when you think of this emergency use authorization that the Pfizer, the Moderna, the J&J vaccinations were all approved under, what this emergency use designation signifies is that through the research, we've learned enough that we can feel comfortable putting the vaccines in people now to save lives. You may recall the vaccines were available to many of us in the February, March timeframe, and we're just now getting the FDA approval for the Pfizer vaccine. So that would have been a pretty long period for us to go without having an FDA approval. So the EAU has certainly, emergency use authorization, has certainly saved a lot of lives. But we hope that this official FDA approval of the Pfizer vaccine, again, will help to ease some of individuals' hesitancy. And hopefully we'll see our vaccination rates go up. And if the vaccination rates do go up, I think this will be one of the best ways for us to combat the virus. So again, you really shouldn't worry if you have the Moderna or the J&J vaccines. All three vaccines have been proven to be safe and effective with the emergency use authorization.
We have Pastor Minister Cheryl Coleman online, and she just gave you a shout out, sir, saying great information, great information, great information. Cheryl is very much a part of the Live Healthy Miami Gardens Health Initiative. She is a nurse, superbly qualified. In fact, she is the Reverend Doctor Cheryl Coleman, and I'm giving her a big shout out because Dr. Coleman, I hope and I'd like to hear more comments from you or questions from you. Let me just put it this way. Dr. Coleman, please come on board and share the partnership in our interviewing. But preferably, I would like to think, let's grill Moses and let's dig down a little bit more with this. One thing I heard you say, and thank you. You said, no need to worry. As a reaction to this term, emergency. That is in essence, as I understand it, it's a technical term. It's more so a medical terminology. It's a designation saying lives depend on this, to give people a chance to live. Because with the slaughter the devastation of COVID, we needed help. The vaccine came along, and it wasn't created out of a vacuum. There's a long history of research and scientific processes to make these vaccines safe with an efficacy of helping people, of giving us a fighting chance. When I did my Moderna in February of this year, I mean, when I did the first one, I skipped out of that place where I'd gotten the first one, and I was the happiest and most grateful person. When I got my second jab, I was even more excited, and I took myself to lunch.
Well, Father Ward, we have a lot in common. We obviously have the same barber, and I too got the Moderna here, so lot in common here.
Thank you very, very much. But there are still people, after all this has been put forward, who are hesitant because they believe it can make them sick, transferring COVID-19 disease. What would you say to, and there are such persons in my own family and even in my own congregation of Holy Family with that opinion. What would you say to them, sir?
Sure. Well, I think it's important to realize that none of the authorized COVID-19 vaccines in the U.S. contain the live virus. So it's not like we're actually putting COVID-19 in your body in comparison to some of the other technology in other vaccines. The COVID-19 vaccine cannot make you sick with the actual virus. When you do receive the vaccine, you can experience some side effects, which is, normal signs that your body is really just kind of building up a protection or an immunity to fight the virus. Very similar to what you may feel from a flu shot. So in most cases, these side effects go away, typically in a few days, and some people, they actually don't experience any side effects at all.
Well, one of the things here is be patient in all of this, but be wisely patient. Where, for example, go and get the vaccine. There is the practice that on getting the vaccine, you're asked to be to remain in place for 10, 15, 20 minutes just to see how your body responds to it. And I think that's a wise encouragement. Be patient, understand your body. Dr. Coleman says, not sure if this was covered, but does the current vaccines work against the Delta variant?
Yeah, great question. So they do. Certainly the variants have contributed to some of the breakthrough areas that you see, but it is effective, and certainly you would want the layer of protection of having the vaccine against the Delta variant versus being unvaccinated.
Again, to our guests, our audience, we're in conversation with Moses Allen, Vice President, Pharmacy of Sunshine Health. And this organization is located in the beautiful city of Tampa, Florida. But before we went live this afternoon, I was just playfully reminding Mr. Allen that Miami Gardens is the most absolutely incredibly beautiful place in all of Florida. As beautiful as Tampa is. Do you want to have a little fight about which is more beautiful?
Well, the cool thing about Ambetter is we're statewide, so we get to be in both Miami Gardens and Tampa. So we don't have to fight at all. Yeah.
I love that, sir. You certainly put me in my place. I gotta go. I gotta, but Miami Gardens is still the gardens of the state of Florida, sir.
I
Yeah.
would agree. I would
Oh,
agree. Miami Gardens is a
thank you
beautiful
so
place.
very, very, very much. Thank you so very much. Um, let's focus on. We touched, I believe, a little earlier on. You know, um, but it's worth repeating. If someone has already had COVID-19, should they still get the vaccine?
Absolutely. Without question, they said you can get the virus again. The COVID-19 vaccines, they reduce the risk of getting sick with the virus, and it helps reduce the risk of spreading it to others. So unequivocally, yes.
So what I hear you saying is, do the kind thing. Get the vaccine before, during, after, and become the proclaimer and encourager and supporter to others. We want to and we will get through healthy together. And as having to do with uh, COVID-19, having to do with this dreaded disease, and having to do with the Delta variant, do the kind thing. Do the kind thing. Encourage, get the facts, dispel the myths, get the vaccine. I'm just a rabid, passionate evangelist here, and thank you for your wise words. We had a comment. I saw a comment. If Tracy, you can post the comment again from our wonderful leader here of the Live Healthy Miami Gardens initiative. Great segment. Thank you, gentlemen, for bringing this much needed info to our community. Thank you so much, Tamara, for the work you continue to do in this area, for you and your team in encouraging us. Moses, you notice, how I'm repeating myself. I could just pause, shut up. No, I can't shut up. If I'm going to, you know, if I and we are going to champion encouraging our people to get the vaccine, and Moses, let me just say, whichever is available, accept it. Because what
Uh,
I'm
Absolutely.
noticing is that people are running around. Do you have the JJ here, or do you have the Pfizer here, or do you have the Moderna here? Whatever is available, just get it.
I would agree with that statement, and certainly I want to thank the previous comments, and thank you again for having me. And I would echo what you just said, 100%. Whatever vaccine is available, you certainly want to get it. There certainly are a few differences between the vaccines. For example, the J&J is just a one-time dose versus the Pfizer and the Moderna, which are you have to get it twice. However, again, the ultimate goal here is to protect yourself, protect your loved ones, and those around you to the best of your ability. So I definitely would encourage everyone to just get whatever is available.
Another critical, thank you, sir. Thank you, thank you, thank you. Another critical, significant, important area has to do with our women who are pregnant or those who are trying to have a child. Should they still receive their vaccine?
Without question, yes. The CDC has shared that if you are expecting a child or if you would like one in the future, it's probably best to go ahead and get the COVID-19 vaccine. Now, I do have to give the disclaimer that, I'm not a physician here or an OBGYN, so you may want to consult your doctor if you have any additional questions, but certainly per the CDC guidance, it certainly is the best option for those expecting.
Part of what you're saying is do your homework. Yes, thanks again to those who are online and those who will participate, view this later on, that we're sharing the information, we're offering the encouragement to go and get your vaccine, whether it be JJ, Pfizer, or Moderna. Um, do the kind thing to protect others and to care for yourself. And for our ladies who are pregnant or those who are trying to have a child, that they would consider this as important for they themselves to get vaccinated, but also to be able to follow up with their healthcare providers. Have the conversation. Moses. One of the great things about all of this is which is what I'm seeing is more persons are beginning to pay attention to their health, to their well-being, and I hope it's a new habit or a reinforcing of the habit of being responsible for your health. Go to your healthcare provider, ask the questions. And I'm going to have to put a plug in for Live Healthy Mind events. That persons would continue to come Tuesday after Tuesday at 3 p.m. and hear the informed persons, the skilled persons who are passionate in sharing the information to help us to be healthy. Do the kind thing. Take good care of yourself, your health. Check in with your doctor. There was and continues to be the free drive-through for vaccines, but those services, it seems, have become fewer. So if someone hasn't had the vaccine yet, is it still free? Do they need to have health insurance or whatever else? Help us with that, please.
Yeah, great question. You're correct. The drive-through, some of them have, sort of declined here just due to some of the fluctuations and, vaccine administrations. But it's important to note COVID-19 vaccines are available for everyone at no cost, regardless of your insurance status, whether you have insurance, whether you don't have insurance. There's no cost to anyone that wants to get the vaccine that's eligible. Now, I do want to pivot here for a second and just caution everyone to just beware that if someone is asking you to actually pay for the COVID-19 vaccine, then it's likely a scam. I would even go back and say and remove the word likely. It is a scam. If you're having trouble locating a vaccine, the CDC has a great resource with the vaccine locator, so you can find a location that's closest to you, and that website is actually vaccines.gov. That can actually help you find the closest location to you. Again, vaccines.gov.
Could you repeat that a third and a fourth time, please, sir?
Sure. Vaccines, vaccines.gov. 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 G-O-V.
Recently, I went again in search of where I could get testing. Now, this is testing because I had my vaccine jabs late last year and early this year. But I traveled recently, and as soon as I got back, I imposed my 3-day quarantine. And on the fourth day, I went and I got tested. Now, I'm not sure I'm supposed to say this in public, but 3 days after that, I went and I got a second test. Now, you're just going to have to say, well, Father Ward, you are one big scaredy cat. And I say, amen. Father Ward, you are one big afraid. And I say, amen. But it's taking responsibility. It's doing the kind thing. And what we're discussing here this afternoon is health and well-being. We're talking about the safety and the efficacy of getting vaccinated, here. I'd like to move to another, and this is my most favorite all-time heartbeat. It has to do with our children. Can we talk a little bit about kids and getting back to school? Most kids in Florida have already returned to school. Parents, though, and I hear it, I hear the conversations, they're still very, very worried and want to do everything they can do to keep their children, to keep their families. They want to do the right thing for the sake of safety. Would you speak to our parents? What must they do?
Yeah, absolutely. And full disclosure, I'm in that exact same boat. I'm a parent here of two handsome boys, 13 and 11. And I think that the advice that I would give is, number one, consider having your child that is 12 years and older receive the vaccine. The FDA has approved the Pfizer vaccine for emergency use for children 12 and older, but it's FDA approved for those 16 age and older. Again, emergency use, you're good to go. So the CDC also recommends everyone 12 and older get the COVID-19 vaccine to help protect against the virus. With kids returning to the classroom, having that extra layer of protection, it just gives parents the peace of mind that things can get back to normal. I guess in this unnormal environment.
So vaccine is available for kids 12 and older.
Correct.
May I also add, I have used the term "do the kind of thing," that in addition to the getting vaccinated is, in my opinion, I would encourage wear the mask, and as best as possible, do the social distance. Kindly do the kind of thing, and help your family, help your own children, and help your neighbors, and help your community to do the kind thing to protect one another. We're seeking all to be healthy together going forward. Do the kind thing for your neighbor and for yourself. And for children who are under the age of 12, what can families do, or what can those gifts that is of 12 and under, what can they do?
Yeah, great question. And again, I'm actually in this exact same boat with my 11-year-old son. Actually, soon to be 11. He actually turns 11 tomorrow. Tomorrow's his birthday. But a few things that you can do here. Number one, if you're eligible to get the vaccine yourself. Keep in mind, if you're vaccinated, you can help prevent the spread to others. Number two, if you're like me,
that's you just spoke to the adults in the room.
Correct. Number two, if you have multiple children in the home, like myself, and they're over the age of 12, make sure that they get vaccinated. Okay. And then number three, you actually just hit on this topic, Father Ward. Be vigilant. Please wear a mask. It's not a time to let your guard down. The mask can help maximize protection against the Delta variant and certainly help prevent spreading to others. However, it is important to note that we aren't recommending that you put a mask on children that are under the age of 2.
I interrupted to get stretched to my library, and I'd like to make reference to a book that I have begun reading. But I'll come back to that in a moment. Um, does Sunshine Health offer any other resources? I'm getting back now to the deliverables and the helping to help us do the kind things and to be, as is the commitment mission of uh, Live Healthy Miami Gardens. What other resources do Sunshine Health offer? And
Yeah.
let me warn you to be careful because I would like a ton of those resources to be delivered by 9 o'clock tomorrow morning.
Yeah. Well, look, great question, and certainly one that we're happy to talk about. The pandemic has affected our communities in numerous ways beyond just getting sick. I mean that's why we're happy to say that at Sunshine Health we partner with a number of community groups across the state and offer community and we actually offer the Community Connections hotline, which is actually open to anyone, not just our members, but it's open to anyone who actually needs help finding things like affordable housing, food, childcare help, and so much more. And again, I want to reiterate. This is not just for our members. This is for anyone. They can actually call the Connections Community helpline. We want to help as many people as possible, and we want to help everyone address the needs of these needs so they can focus on their health.
Thank you so very, very much. So you don't need to be a member of Sunshine Health, but you can be resourced by Sunshine Health through ambetterfl.com or call 877-687-1169. Let me repeat that because everyone who is listening, would you pick up the phone right now? Come on down, pick up your phone and dial Moses Allen.
Okay. Well, let me just jump in here to provide some clarity. If you are interested in becoming a member of our health plan, certainly on the Ambetter side, we'd love to have you. And that's the number and the website that you see floating at the bottom of the screen here. But going back to our Community Connections health line, that is open to everyone. Actually, we may want to put this number in the yes, 1-866-775-2192. And again, open to everyone. We can help you find a food pantry near you or a nonprofit that can help you with rent or utility assistance. It's an easy way to connect with social services in your area. And again, it's one of the benefits that we offer. We're proud of the community partnerships that we connect. And, even if you're not our member, I mean, we certainly wish that you'll become our member, but even if you're not, we're a resource to help at the number that was, at the number that's provided, 866-775-2192.
Absolutely. Thank you. Thank you. I cannot say thank you enough. I could probably spend the rest of the evening saying thank you to Sunshine Health, because that is the passionate commitment of Live Healthy Miami Gardens to connect our people, to make themselves available to access the resources. Let me just put it in my own way. There are no excuses. You have a question, you have a helpline. You need access to whatever equipment, hardware. Here's a great resource, ambetterfl.com, and you may call at 877-687-1619 or the helpline 866-775-2192. You see, I have repeated this so many times that it's becoming almost a second nature here. full of gratitude. So much great information has been shared here today from Moses Allen, Vice President of Pharmacy Operations at Sunshine Health. Did I say that right, sir? Pharmacy Operations.
You get an A+. You said it right.
Hey! This is how we do it. This is how this is how we do it. Beverly Finley says, "Thank you for that information. How do you become a member?"
Yeah, great question. Our information is floating here at the bottom of the screen. If you could just visit our website or call a number, we'll get you signed up.
Can I say something smart? That Beverly can call the Episcopal Church of the Holy Family, and we will link her to Live Healthy Miami Gardens initiative. We will link her with Tamara Bruce, our great leader of this initiative, and her staff of Tracy and Quinn. Ask the question, you'll get the answer. Will provide the support, the encouragement for us to do the right thing. Great information, Moses. Anything else you'd like to share with our viewers
Yeah.
before we go off to dinner? And dinner will be provided by Sunshine Health.
Well, I do have just a few things. Number one, I know this is a very important topic, one that's certainly close to me. But one thing that I just wanted to highlight is that a lot of the vaccine hesitancy is actually seen in Black, Hispanic, and minority populations. And I get it. It's probably due to some of the historical inequities that these groups have faced here. But when you think about it, a lot of our essential workers that are on the front lines during the pandemic, as first responders, working in the grocery store, delivery service workers, they belong to these minority groups. So again, I just encourage you, particularly if you are in one of these minority populations, to get the vaccines to protect, yourself and your loved ones here. Again, the take-home message for today, for me, and again, thank you, Father Ward, for having me on. It's certainly been a pleasure. But I just want to reiterate to everyone to please go get your COVID-19 vaccine. Don't wait. It's the best way to protect yourself and your loved ones. Also, having health insurance is more important than ever, during these times. I mean, when families are struggling, some people are losing their jobs. Having health insurance provides a peace of mind and helps family focus on health. And, here at Ambetter from Sunshine, we're a health insurance plan option available to individual families. When you choose Ambetter from Sunshine, you're covered for benefits such as maternity and newborn care that we spoke about earlier, mental health services, prescription drug coverage. And again, you can learn more, about our health plan at ambetterfl.com and the number floating below. So again, just want to thank you for having me on board today. It's been a pleasure, and certainly enjoyed the comments. And just want to say thank you.
I have to put a plug in for my city, the great city of Miami Gardens. Our people are smart. Our people will follow through, will take initiative. I hope, and more than that, I guarantee that you will have your phones ringing off the hook and visiting your website. The other thing too, I don't recall hearing you say, but these deliverables, these services are available at are affordable or available at affordable prices. And I hope that will continue. not just in the midst of this pandemic, but for years to come.
Yeah, yeah, certainly. First and foremost, the vaccine is free, right? I mean, whether you have insurance or if you whether you have insurance or if you don't have insurance. But certainly, if you're looking for a health plan option, certainly we have very affordable products for those looking.
I pulled away from off screen. I pulled off screen a little while ago. Reached out to my library for a great resource that I have skimmed through all 600 pages of this book. I have read a portion of it, and it's titled "Epidemics and Society: From the Black Death to the Present," written by Frank Snowden. And let me just share. The point I'm trying to make is, do your homework. Get as much and share with one another. We've had disease, and our scientific community has been hard at work. Services like your Sunshine Health continue to make health services available, so that there is a system in place to support us. And we see reflected here in this resource, Epidemics and Society, the history of epidemics, and that it is manageable if we but do the right thing. This book is a sweeping exploration of the impact of epidemic diseases, and the book looks at how mass infection outbreaks have shaped society. The writer reveals the ways that diseases have not only influenced medical science and public health, but also transformed the arts, religion, intellectual history, and warfare. He touches on themes like medical therapy, play literature, poverty, the environment, and mass hysteria. And I'm going to pause right there. In fact, I'm going to end right there. That having you here today, sir, is a way of yet again, in partnership with Live Healthy Miami Gardens initiative, to put the mass hysteria aside, to put away, to debunk the myths that are in our midst, that block people, that create that which we call the vaccine hesitancy. Here today, gratitude to you and to Sunshine Health in providing the fact and the facts, in providing the truth and the reality, and to provide the encouragement for people to take initiative for their well-being, to do the kind thing. And I say, I'm repeating myself, to do the kind thing instead of simply saying doing the right thing. Because the kind thing, and I'm a preacher, okay? So I got to get some amen in the house. Do I get some help here? Do the kind thing for those around you, for the community at large, and do the kind thing for your own self. Do the kind thing for your family members. And I'm going to make a very, very special plug. Do the kind thing for our next generations. More to come with vaccination or vaccines for our 12 and under. But where the vaccines are available for 12 and older, do the kind thing. Pay attention, families, parents, and be a part of the conversation as to what happens with our children in school. Very important advice. Penn's the Honorable Lonnie Lawrence. He's a great friend of mine. Very important advice to help us live healthy. Great work. And he says, Father Ward, but I'm going to amend my friend's comment and say, great work, Mr. Moses Allen, Vice President of Pharmacy at Sunshine Health. Even though, sir, you're located in the wonderful city of for you to connect and be a partner in delivering and sharing, encouraging us here in the great city of Miami Gardens. On behalf of the host committee of the initiative, on behalf of Tamara, Tracy, and Quinn, thank you so very, very, very much.
It was a pleasure. Thank you.
We look forward to seeing you tomorrow morning at 9 o'clock in front of City Hall with everything from Sunshine Health. My brother, God's goodness, thank you so very, very much.
Thank you.